Hi everyone, my name is Carinna K Coletti and I am an honors student in Characteristics of Diverse Learners this semester. My honors project has consisted of me writing a big report about response to intervention. So this is my summary video in which I'll be explaining response to intervention pretty simply and giving you guys a lot of implementation for usage as a teacher in your future classroom. So I hope you enjoy! The main goal of response to intervention, or RTI, is to catch students that are having difficulty with a subject, provide instruction in a more appropriate manner to that child's learning style, and in the best cases, help that child not be diagnosed with a preventable learning disability and be moved to special education. RTI focuses on providing a research-based curriculum for the Tier 1 process and then building upon that for the Tier 2 and Tier 3 process. There are 3 tiers for RTI. The first tier is what we consider to be general education. However, with an RTI implementation in schools, this curriculum becomes more research-based and data-driven. Response to intervention Tier 2 is going to be what we consider more direct instruction specific to what the students need. The last tier, Tier 3, is a step down from special education and includes one-on-one time with the teacher or teacher aide with very direct, specific instruction. All 3 of the tiers should have the same curriculum, and Tier 2 and Tier 3 are supplementary to Tier 1, not a replacement for it. If students struggle in Tier 1, they're moved to Tier 2. And then if they continue to struggle in Tier 2, they're moved to Tier 3. If in Tier 3 the students manage to make adequate progress before the next testing period, they can move back down to Tier 2. However, if they cannot make enough progress in an appropriate amount of time, they might be moved to special education. There might be a referral in order. In this video, I'll be giving you a little bit about the history of RTI, the components of the response to intervention plan. I'll be delving into the tiers a little bit more, give you a little bit of the controversy surrounding RTI, and then I'll also give you some implementations for your classroom as future teachers. RTI is not the first program to intervene early and help students avoid a special education referral. Before response to intervention, many students used what was called the discrepancy model. This model compared IQ scores and test scores. This model was not very effective. If you had a higher IQ, but you scored low with your academic progress, you might be referred to special education. However, if the opposite was true, you had a lower IQ and high academic performance, you might still be referred to special education, even though this was not something that you needed as a student. The more that teachers and researchers did studies on this and watched their students go in and out of special education, the more that they determined that, while special education does help with academic performance, the main goal is to help those students be able to socialize normally, to have that social cognitive development that's needed. So with this knowledge and knowing that a lot of their really smart students were going into special education and the numbers were all messed up, a lot of teachers and educators and psychologists became really frustrated with this discrepancy model. This is where response to intervention was born. A lot of teachers argued that if they were given better curriculum, if they were allowed to meet with students either in small groups or with just one-on-one, that they would be able to prevent that special education referral. As psychologists and educators started really building up this idea, they realized that this RTI structure format of the 3-tiered intervention process that they had going on really ran off of 2 assumptions. The first was that the education system could teach every student effectively, no matter what disabilities the student has, no matter what the student might be struggling with. And the second equally important assumption is that early intervention and implementation of a 3-tiered model is the best way to go about instruction. This system needs to be driven by data, driven by assessments, driven by meeting with the student and asking them what they're struggling with. This was not going to be a simple process. This required a large team and everyone to be on board, from the student to the parents to the educators and faculty members. It was not going to be an easy way, but they were willing to begin to build up this process. As I mentioned before, RTI is driven by a lot of data and decision making. However, when the components of an RTI work together successfully, this is a smooth process. The main components are the RTI team, which consists of teachers, parents, faculty members, and the student themselves, a solid assessment method, a guide to the tiered intervention process, and a problem-solving procedure. Armed with this new idea of early intervention and a 3-tiered instructional system, many educators put forward this idea in 2004 with the IDEA bill. It's not a part of the law per se, but it was introduced as a method to help identify students for the IDEA Act. From 2004 to 2008, psychologists, educators, researchers, and a lot of schools in different school districts fine-tuned the RTI program and found a lot of errors and a lot of things that they needed to fix, and then worked on fixing those. When IDEA was reauthorized again in 2008, RTI became a much larger component of that plan. Many schools don't use RTI necessarily to screen students for special education or to find students who are struggling, but many schools have begun to implement it in order for that 3-tiered instructional model. For the assessment portion of the response to intervention plan, the RTI team uses 3 tools. The first is a universal screening for all students. This is normally what we call standardized testing and helps the RTI team determine the grade level standard for that specific school. This also helps teachers and faculty members notice outliers, which are students that might be at risk for RTI or special education. The second is a diagnostic assessment. Once the student has been selected to screen for RTI, they must go through a series of tests to see what their level is. The third and arguably most important is the progress monitoring. After a student has been assigned a tier, it is crucial to make sure that the student is making adequate progress and receiving the specific types of instruction that they require. The team combs through this data and translates it into a plan for that specific student. This plan can move the student up or down a tier, increase the certain type of instruction, or include more guidelines for a teacher. Now that we understand how a student is assigned a tier, we can discuss the specific tiers more in depth. Tier 1 is again what we consider to be general education. However, RTI strives to change the curriculum that is taught in this tier and make it more direct. Students who receive direct instruction and are given clear objectives tend to struggle less than students who do not receive these benefits. The curriculum that is implemented gives teachers specific guidelines and provides them with a research-based, data-driven way to teach the subject. Another goal of RTI is to provide a form of accountability for the curriculum. This means that, assuming all schools use the RTI program, the level of education around the country will be identical. This is the ultimate goal of that standard education system. Whether or not this is doable is up to debate, but that's the outline of the Tier 1 curriculum. Students who continue to struggle at Tier 2 are then transferred to Tier 3. Again, this is not special education, even though some schools use it as special education. Special education is normally a completely separate curriculum, whereas Tier 3 of RTI is again supplementary to Tier 1. Students in this tier receive intensive one-on-one instruction with the teacher 2 to 3 times per week. The student is given the freedom to tell the instructor when a learning style isn't working and in fact is really encouraged to talk about it. Instructors in this tier need to provide extremely explicit and systematic instruction for students to see the direct connection to previous knowledge. Ultimately, the goal of Tier 2 is to return the student to Tier 1. The goal of Tier 3 is to return the students to Tier 2. If a student does not make adequate progress or worsens by the next assessment period, the RTI team might consider a special education referral. As much as RTI seems like the perfect intervention system, there are many parents and educators that are concerned with this method. RTI can quickly become another wait-to-fail program in which students are not helped quickly enough to prevent drastic consequences. On the other hand, faculty members and administrators are concerned about producing a disproportionately large number of false positives thus concerning parents and students, opening up a student to bullying, and taking away much needed time away from already overworked teachers. Because of these differing views, there are two types of RTI. The first is typical RTI, and the second is dynamic RTI. Typical RTI requires that students slowly progress through the tiers, giving them more than enough time to make progress or for it to become absolutely necessary for them to move tiers. This may be beneficial moving students from Tier 2 to Tier 3, but going in reverse, moving students from Tier 2 to Tier 1, is a difficult process for many. Typical RTI utilizes the standard 8-week testing period for assessment and monitors progress on a long-term basis. On the other hand, dynamic RTI takes data from pre-testing and school standards, and students with low scores are immediately put in Tiers 2 or 3. There are many students who benefit greatly from this quick intervention, but many students don't need it. This causes many false positives. However, even students who belong in Tier 1 can benefit from more direct instruction, so many teachers agree that dynamic RTI is the best form. Ultimately, there appears to be no reason to wait and hold students in Tier 1 if they pre-test at a more intensive tier. It is crucial that we do not let RTI become a wait-to-fail program. But what does all of this mean for you as future educators? It's handy to know the definitions and to have a general knowledge about all this, but how can you implement it into your classroom, especially if your school doesn't have an RTI program? I will outline some great strategies to use at all the tiers, or just in general if you don't work at an RTI school. In Tier 1, it is important for teachers to utilize strategies that clearly outline what the students will be learning. This helps students pick up on information that is actually relevant to the lesson and objective while sorting out unimportant information. Teachers can do this by stating the objective, giving direct instructions such as explicitly giving the full definition of a new term, utilizing note-taking techniques, and using hand-on, non-linguistic representations to help students associate physical items with new concepts. Teachers should also recommend student interaction, provide feedback, reinforcement, and recognition, and restate the objective when the lesson is finished. To visualize your lesson as a sandwich. The bread is the objectives, which should be on both sides of the lesson. The sandwich filling needs to be only beneficial activities to the students and should include a variety of tastes, just like a real sandwich. For Tier 1, many strategies seem like common sense, but are usually overlooked while actually teaching a lesson. In many instances, teachers run out of time or simply do not use these strategies. While you're teaching, make sure to visualize the sandwich and the strategies that you want to use for your student, and make sure to provide a variety of activities. For Tier 2, the students are broken into smaller groups, which allows for more intense instruction. But if you state the objective and give explicit instructions, how do you intensify this? First, you need to segment new information. Instead of giving students an additional full lesson, teachers need to take the time to break down the information from the Tier 1 curriculum. The pace is also much slower. Much of the time is spent going over old concepts, reteaching the new information, and practice lessons. Many of these activities are allotted more time than in Tier 2 than in Tier 1. It is encouraged for students to ask questions in this and work together as a group. Students begin feeling more comfortable telling a teacher they do not understand a concept in this tier. Tier 3 instruction is the most intensive and is reserved for students who do not respond to Tier 2 intervention. The instruction is very individualized for the student based on their learning style and individual interests. Students in this tier are encouraged to talk through their thought process while they learn in order for the teacher to find a potential gap in knowledge. Most often, students who receive Tier 3 intervention work with a specialized teacher who is trained in Tier 3 techniques. Teachers model how to think and ask students to work aloud, teach more explicit and systematic instruction, and help students work on memory skills. Another crucial skill that is taught in Tier 3 is how to ask beneficial questions until they receive information that clears up their confusion. If a student is not successful after this intensive intervention, the RTI team refers the student for special education. Response intervention can be an extremely beneficial tool in the right hands. Faculty who is committed to providing the correct resources, teachers who are trained correctly, parents who speak for their child, and a student willing to communicate can all impact this process. As educators, it is important to understand the history, components, and tiers of RTI. As someone who needs to have an opinion about RTI, it is important to know what the controversy includes. Whether you teach in an RTI school or not, response intervention impacts your life and your students' lives. Utilizing these strategies in your classroom can assist all of your students. Thanks for watching my presentation. I enjoyed creating this project and learning all about response to intervention. You can always ask questions in the discussion board or do some research for yourself. Remember that as an educator, you have so much power in a child's life. Be a champion for them, constantly uplift them, and see how they prosper.